Welcome, everyone. Welcome to this webinar for health professionals interested in moving to New Zealand. My name is Fabian Maisonneuve, and I am a licensed advisor at New Zealand Shores Immigration. New Zealand Shores is an immigration consultancy with offices in New Zealand, in South Africa, and a team of 16 licensed advisors. We've actually successfully assisted over 13,000 migrants to make the move to New Zealand since 2009. Today, we're going to talk about moving to New Zealand for health professionals and what opportunities are here for all of you interested in making the move. There might be some time at the end for questions. We have people in the background attending the Q&A. But first, I'd like to introduce our panelists today. We have Charlotte Stockman, my colleague and licensed advisor. Charlotte will give us some insights into the latest immigration updates and upcoming changes. And first, I'd like actually to introduce Prudence Thomson, our partner and director at Accent Health Recruitment. Prudence will kickstart the discussion. And well, first, would you like to introduce yourself and Accent and what you can do to help?
Sure. Hi, everyone. Morena. Kia ora. My name is Prudence. I have with me typing questions, Kristen and Hayley. I've been recruiting for 25 years and I'm a nurse by background. We only recruit into New Zealand, not out, and I'm here to help you with any questions about work, living, everything apart from immigration that Charlotte will do. So any questions you've got, you can type in the Q&A so we can all get a feel for the questions and answers, because I'm sure you'll all have the same questions to be answered. So welcome everyone. This is going to be a great 30-minute chat and a chance to answer some questions.
The first quarter of every year is traditionally a very busy time of the year for recruitment. Is that something you've noticed as well, or is that even more than the usual, considering we're in a kind of a post-COVID era?
Thanks, Fabian. We've had quite a large increase in vacancies and placements. This is probably post-pandemic. Also more funding into jobs, so increased in salaries, and also a relocation allowance for most people coming from overseas up to $10,000. So not everyone is eligible, but the majority of people will be eligible to apply for it. And it's a pretty good opportunity to come to New Zealand, have your flights, shipping and accommodation paid for.
That's awesome. Another major change that happened last year outside of immigration is the merging of all district health board into one organization, Te Whatu Ora. How has that made any difference in the way you recruit or where you can place people?
At this stage, Te Whatu Ora, which is New Zealand, is slowly coming together. You know, it's big work combining 20 district health boards, and it's taken a while to get everyone together and on the same page, but it's seen as really positive.
Okay, awesome. And what's the status with registration across the various registration boards? What kind of timing are we looking at the moment?
Yeah, some really exciting changes with the registration boards, which is great. So the physio registration, if you're registered in the UK, you can get your registration through in around 10 working days, which is fantastic. So physiotherapists is streamlining. Nurses Council are making some changes as of the 1st of May with the CGFNS. That's the moving forward, everyone who applies from the 1st of May onwards. We'll have that streamlined as well. Medical Council are really good to work with. They take 20 working days. So the registration process is changing, it's streamlining, and it's helping meet the demand of the workforce in New Zealand.
Talking of demand, what's super hot at the moment? What are you most placing for?
Physios, OTs, speech language therapists, nurses, midwives, operating department practitioners, sonographers, radiographers, GPs, consultants.
The whole lot.
All medical professionals. I hope I haven't missed anyone out. Pharmacists.
Okay. Sorry, I missed that last one.
Pharmacists.
Pharmacists. Okay.
Yeah.
Awesome. Well, I'm going to turn to Charlotte now. We have a quick presentation that summarizes the essentially the migration process, but more specifically the visa pathways. So just going to pop that on the screen. So yeah, essentially, Charlotte will go through the various steps that are needed to properly prepare your relocation and the key visas that you might have to go through.
Yeah, so hello everyone. So we will cover off a few different topics quite quickly. So if you do have any questions at the end, please do let us know. I will leave Prudence to talk through this first slide actually, because this is right up her alley.
So occupational registration is you must have your license verified and apply for your license in New Zealand. As I said, that process can take anywhere from 10 to 60 days, we would say. The occupational registration is required for a job offer and also to work in New Zealand and for your visa status. The documentation we need is pretty straightforward: passport, degree, registration. We need CV and references. So we get references from your employers, your line manager, your current manager, and or your past manager and senior colleague. We send them quite an involved reference form, and that reference form is used for the registration, it's used for immigration, it can be used for finding accommodation. So that one reference form, we only request it once, but we use it multiple times. Our job search strategies are pretty in-depth. That's what we experts are. We're a free service and we work exclusively with you. So just to repeat, we're free. We don't charge you for anything, but we do work exclusively with you. So we will only work with people who are working with us as an agency, because New Zealand's quite a small place and you don't want to muddy the waters. We will look at opportunities that are commensurate with your experience and your training. If you've come from an orthopaedic surgical background, we'll look at an orthopaedic surgical job in New Zealand. If you've come from mental health, we'll look at mental health. 2 of us out of the 5 on our team are registered nurses, so we've got a really good understanding of the process and your skills. We'll ask you quite specific questions, you know, can you extubate, can you cannulate, where's your CPR update up to advanced life support, your mental health strategies, your family health, everything we will ask just to do with your role. And so we do that work on your behalf, and we're the preferred supplier in New Zealand for health jobs, which is really good, and we love doing what we're doing.
Excellent. Thank you, Prudence. Charlotte, can you talk a little bit about the kind of documentation that's required for immigration and visas specifically?
Yeah, absolutely. So it is a little bit in depth. You will need to prove your identity. So things like passports, unabridged birth certificates, passport photos. As healthcare workers, in terms of, you know, proving that you can do your job, in 9 times out of 10 cases, immigration will just accept your occupational registration in New Zealand. So that's quite straightforward, which is good. It doesn't leave you having to chase, you know, written work references or examples of, you know, the work you can do. So that's nice and easy. You will have to get police checks from different countries you lived in. You will have to get medicals, and you will have to also, if you've got a partner traveling with you, you have to be able to prove that you are in a genuine and stable relationship. So there is a little bit that goes into it, and you know, immigration do want to see all of that information, and they want to see it all thoroughly. So it can sometimes take longer to get your documentation together than it might take to get your occupational registration.
Right. So once you've got registration, you've got most of your documentation consolidated through New Zealand Shores and migration agent, and you've secured the job, you can then move on to securing a visa. So there are a few options there. As of last year, it is a mandatory requirement for any New Zealand employers wanting to recruit a migrant to become accredited. It is largely a compliance exercise for the employer, so nothing the migrant needs to worry about. If they were to secure a job with an employer that's not accredited, it's something we can talk them through. And the processing for the actual accreditation is super straightforward and quick. And yeah, a lot of workers might go for an employer visa.
Yeah,
in the first instance. Sorry, getting a bit of echo there. So yeah, I was saying most work visas are granted for 3 years, And then as soon as the visa is approved, you can come to New Zealand and commence work. If you have family, partner, dependent children, they can apply for visas on the basis of their relationship with you. They're not typically processed exactly at the same time, but surely within the same week to allow the family to travel together. The question with the recent immigration changes is, as a health professional, do you even need to go through a temporary work visa? You might be actually able to apply straight for residence. One thing important to note is that there is a cutoff age for residents. You need to apply before you turn 56. So the cutoff is 55 inclusive, but there's absolutely no age limit for temporary visas. So if you're over 55 and just want to get some work experience, you can definitely apply for a work visa as well. Charlotte, would you like to run through the different residence pathways for health professionals?
Yeah, absolutely. So there is a bit of change happening in this space at the moment. There is a whole, I think it's 32 or 38 occupations in the health space being added to what's called Tier 1 of the Green List towards the end of the month. And that will basically mean that all health workers will be able to apply straight for residence. There are a couple exceptions to that, which we'll talk through at the end of this presentation, but for the vast majority of you, that straight to residence pathway will be the best option for you. There is also what's called the skilled migrant category, but given the changes we're seeing coming in the next few weeks, it wouldn't really be worth anyone in this webinar to even consider that as an option. The fast track to residence is exactly what it sounds like. It is a fast track residency process. Typically takes roughly about 4 to 8 weeks to process. Sometimes there are anomalies to that, which mean could process a lot faster or it could be a bit slower, but that's the average we're seeing at the moment. So the existing roles that are on Tier 1, which give you that fast track residence option, are listed there. And that is, like I mentioned, being expanded at the end of the month. So I'll get you to pop onto that next slide, Fabian.
Yep, so roles moving to Tier 1.
Oh, sorry, you have already moved. Yeah, so the roles moving to Tier 1 at the end of the month are listed there as well. So it does widen up the options, and it's not a points-based system. So if like the skilled migrant category, you had to be able to claim a certain number of points through your age and work experience and qualifications, etc. This is purely just based on your job offer and on your occupational registration as well.
So, like we said, some roles have been on the green list ever since September last year when it was released. There were a couple of additions just around about Christmas. And now on the 29th of May, some roles that were on the 2-year pathway actually moving to fast track straight to residence. So these are the roles that we can see right now. Anesthetic technicians, sonographers, OTs, radiographers, for example. And Immigration New Zealand, feeling clearly very generous, has dumped a whole lot of new occupations that immediately qualify also for residents upon securing a job offer. There are so many, I'll try to fit them all on the slide, but if it's too small, contact us and we'll give you the whole list. It's on our website at newzealandshores.com anyway. But yeah, some brilliant options for health professionals across the board. As a matter of fact, there's no health-related occupations under a 2-year pathway other than nursing assistants or care workers. So these do not typically require occupational registration. The requirements in terms of work experience are relatively low, just 1 year will suffice. And as long as you secure a job at $28.25 per hour, and you maintain it for 2 years, you also have a pathway to residence. So again, these are care support workers, carers, yeah, all kinds of health-related aids, essentially. But
Fabian, employers in New Zealand, just a quick note, are very excited that they know that people they're looking to recruit from overseas will be coming permanently. So it's increased the interest for us to recruit from offshore, which is seen as really positive.
Absolutely. I mean, everyone's got a unique background and unique requirements. You might want to end up in Christchurch or Northland, or you want that kind of job, or you have that kind of salary expectations. So look, that's what we do. We map out a pathway to securing residence in New Zealand and settling into this new country based on your, what you're after and your job opportunities. So that's why we've been working very closely with the team at Accent. But any question about your specific options, if you have any health concern, is that going to be a bit stumbling block for your migration, please flick us an email, health@nzshores.com. If you haven't had an assessment from us, we do provide a personalized eligibility report that details all the visa categories we've talked about. If you have had an assessment from us, please contact us anyway, because there might be some changes. And yeah, about recruitment or registration questions, you can send them to info@accent.net.nz. One question I had for you, Prudence, is now we have a really good handle on the green list and what that means and processing time, because it's been around for a solid 6 months. Has the green list made a difference to the way employers consider offshore candidates from your point of view?
Yeah, absolutely. So employers see that they can not only recruit permanently, but they can also recruit quickly and get people on permanent residency. So previously you could just get a job work visa and it was less easy to settle, but now it's very easy to settle. You get your residency, you have real assurity that you're going to be here, and it's really smoothed the pathway for medical migrants. It's made it a lot easier to come across, and employers find that very, very attractive.
Awesome. I've got a very good question from Stephen in the chat, and that's one's for you, Charlotte. What is the difference between residents and permanent residents?
So that is a really good question, and it's one that I probably, if I had $1 for every time I answered, I wouldn't be sitting here today. It is a bit confusing. So everyone who applies for a residency visa in New Zealand, so for example, the straight to residency visa, is issued with a residency visa with conditions. Conditions can vary. Typically, we will see that the condition for skilled migrants is that you must remain in New Zealand for 6 months out of each year for 2 years. And then at the end of that 2-year period, you can, I call it a conversion, convert to permanent residence. It is an application in itself, but the form's about 5 pages long. Immigration will just check your movements in and out of the country to make sure you've met that time spent threshold, and it takes about 4 or 5 weeks and you're granted permanent residence. Other than that time spent or those travel conditions, there's really no difference. So you're still able to access free healthcare. You can still study as a domestic student at tertiary level. Your kids can attend school for free. If you've got children who are university age, they can either work or study. So you've got full flexibility. It is really just that, you must spend time in New Zealand to demonstrate a commitment. And then once you've got permanent residence, it's there for life. You can hypothetically leave New Zealand for 20, 30 years and always have the right to return.
And that's right. I mean, like you mentioned, the status while in New Zealand is virtually identical. No one gets permanent residence outright anymore. It used to be a case, but that's no longer a thing. And those initial 2 years is more of a trial period, showing you some commitment to living in New Zealand. We mentioned briefly the timeframes for processing of the green list residence applications, so 3-4 weeks. Considering those timeframes, there's virtually no need to go through a work visa prior to applying for residence, which used to be the case for almost everyone. Can you think, Charlotte, of cases where a health worker with a job in New Zealand might need a work visa as opposed to applying straight for residence?
Yeah, definitely. I've got a dermatologist in that exact situation at the moment who has only got a 12-month contract because they want their children to come out and spend some time at a certain school in New Zealand. So because their aim isn't to travel permanently or live in New Zealand long-term, we're applying for work visas for the parents and student visas for the children. So that's one example. The other example would be if you are from a country where perhaps you need English language tests, because a straight to residence application, if you're not from the US, the UK, Canada, or the Republic of Ireland, you actually have to have an English language test done. And depending on where you are in the world, those can take several weeks to get. So that is quite often one that we see a bit of a hiccup with, is people submit these applications and think because they've got their occupational registration, they don't need an English language test, but unfortunately you do. So that could then delay that residency application by several weeks, if not a few months. So in that situation, obviously you want to get here and start work. So you'd come out on that work visa first and then apply for residency once you were here, and once you've got your English language tests done and all your little bits and pieces tied up in the background.
Wonderful. I have another question that's popped in the chat, but we do get from our clients as well. If you agree to a job offer, are you tied into work for that company or that hospital for minimum time, or can you search for another job elsewhere if you don't enjoy it?
If you come on a work visa, your work visa will stipulate that you have to work for X employer in by location. It doesn't mean you're tied. You can still change employers. You just need to go through a process to have your visa changed alongside it so that it says you can work for the new employer in the new location. If you apply for that straight to residency, you can work for any employer. Obviously in good faith, you should, then turn up and start work for the employer who's offered you the job. But outside of that, you can basically do what you want on that front.
I'm thinking from an employment perspective, and correct me if I'm wrong, Prudence, but if the employer offers you a relocation package, you're probably going to be bonded against it.
Absolutely. And we probably find maybe 5% of people don't settle in their jobs, and we help them get that next job. So we encourage them to stay 3 to 6 months. If they're really, really unhappy and they don't like the type of work or the staff or the patients or procedures, absolutely move on, and we support you to find you another job. And then Charlotte will change the visa, the variation of conditions. We find that people who take the bonding do stay for 12 months anyway, or they repay it. And it's just like an interest-free loan, really. But there is a bonding associated, but they're not going to hold on to your passport. You're not bonded to that contract, or you're not going to be kicked out of the country.
And now, obviously, health workers are in super high demand. How long do you typically have? What's the tolerance threshold for an employer offering you a job until you actually get there and do your day one?
Good question. I get asked that one frequently. We interview people with the hope that they'll be in New Zealand 8 to 12 weeks after interview date, preferably sooner. Some employers will wait 4 or 5 months for you to arrive, depending on the skill and the vacancy and the duration and the staffing levels. If it's a small general practice and you're the one nurse that's going to be coming there, they do need you there within sort of 6 to 8 weeks. And we understand, I've moved countries, I know how much stress and work is involved packing up and moving your life. So we encourage you to be recruitment ready. So have your house sold, ideally, have your job resigned, have your registration, your references, and be ready to be recruited.
Bouncing off that, recruitment ready from our perspective also means document ready. And that's why we like to work with candidates as early as possible. Last thing you want is to secure a job and find that you're missing half the documentation. You're essentially wasting the employer's time or testing their patience anyway. So working with a migration agent, you're essentially ensuring that you've got all the right documents in place and you're kind of visa ready, so to speak. So Accent recruits throughout New Zealand, right?
Yes. Yep.
Where would you find the places are most popular?
Oh, interesting. And this is sign language for New Zealand. And so that's North and South Island. Everywhere. So the top of the North Island, Northland, Whangarei, Auckland, down to Hamilton. We've got the east and west coast of the North Island, Wellington, Palmerston North, Taranaki, everywhere in between. And also in the South Island, there's the west coast, which is a bit more rural, and Canterbury or Christchurch, where we are, but also Nelson, Timaru, right down to Invercargill and Dunedin. So absolutely everywhere in New Zealand. The salaries are the same throughout New Zealand. It does cost a bit more to live in the larger cities. So if you want to go somewhere like Timaru or Dunedin or, Blenheim, Palmerston North, we're there to help you.
Great. I'll just cover a question that's popped in the chat. Maternity leave. If you come here on a 3-year work visa, or if you come here straight as a resident, you get public funded healthcare, which includes maternity leave. I believe it's 16 weeks, isn't it, for mothers at the moment? But you do get maternity leave, and you do get all the maternity costs covered.
You have to have worked for an employer for 6 months initially.
Okay, yeah, we'll confirm that.
Yeah.
As we send the recording. At what stage would you recommend people engage with Accent? If, you know, New Zealand's just an idea, and yeah, I didn't realize, you know, things could actually work out for my family. What's the first step?
I would say, even if you're not coming for 3 years, 2 years or 1 year, engage now and start learning. You'll get a newsletter from us 11 times a year. And often, if, for example, you are you know, an ophthalmology nurse and you're just thinking about it, that perfect job might come up, that specialised job. So engaging with us now, just joining our database. So the first thing to do is just email us if you haven't already with a hi, interested in New Zealand, thinking of coming in the next few years, and we can talk you through that process.
Awesome. Same question for you, Charlotte. You know, at what stage should you engage in the services of a migration consultant?
We are a little bit different, just because, you know, if you're looking at moving in 3 years' time, so there's not much we can do for you right now, just because policy can change. If you don't have a job offer, we can't apply for a visa. I would typically recommend people engage with us up to 12 months prior to their intended move, just because then we can start to work with you on that documentation. It's a lot easier for us, and it's a lot easier for your employer and for Accent if, you know, they know that you've got all your visa paperwork ready. Obviously, pending the job offer, and there may be 1 or 2 last minute things that need to be done, but if the bulk of it's there, it's going to make your whole process a lot less stressful. That's not to say that people can't come to us if they've already got a job, because absolutely they do, and you should, because we can still jump in and take care of that process from that point. It just may mean there's a slight delay in applying for that visa while we help you work through that documentation to be able to get to that submission point.
So your document ready, you've got your registration sorted. Prudence, can you tell me a little bit about the interview process? How does that work and how you can help?
We say the interview is like a first date. So you have to be well presented, well prepared, and have done your research. So you want to know a little bit about the employer, why they might say, why do you want to work in Auckland? What attracts you to this district health board or this Te Whate or a Auckland district job? Be prepared with answers to questions. And if you would like a pre-recording on interviews, email me and just put interview information in the subject line. So email pru@accent.net.nz and put interview information, and we'll send you a little video of how to do an interview and also a whole lot of questions. The interview is a two-way process, so you get to ask them about their role, what it's like to work for them, why should you work for them, and they will of course ask you, tell me about yourself, strengths and weaknesses, tell me about your typical day at work, and also competency-based questions, which are really important to skill up on. Examples, tell me about a time you dealt with a stressful situation, a positive situation, you had a good outcome or a bad outcome. So the questions will vary. Preparation is really, really important, and we do full interview training with you prior to an interview. Great.
Awesome. Well, that just about concludes our half hour, so to speak. Any few words, last words to conclude that you'd like to say, Prudence, and then I'll let Charlotte close the floor.
Preparation, paperwork, and persistence. They're the 3 things. So be prepared, organise your paperwork, and be persistent. And just email us and we'll answer your questions. Happy to do so.
Awesome. Charlotte?
Yeah, I'll echo exactly what Prudence has said there with those 3 Ps. It's definitely the core of our process as well with assisting with that visa.